My name's Hillary Hayden. I'm the organizing director at the Trade Justice Education Fund. Today, we're going to start with getting some background on the Global Access to Tests and Treatments campaign. We'll hear from Maza Seyum of People's Vaccine Alliance about the urgency of getting more tests and treatments available in the Global South. We'll hear from Felipe de Carvalho of MSF Rio about efforts to get Paxlovid access through compulsory licensing in 4 Latin American countries. And then after we hear from Felipe, we're going to take a few of your questions, which you should put in the Q&A feature below throughout the webinar as they come to you. And then before we close out for the day, Ime Shao, our own Trade Justice Education Fund organizer, will give us some action steps we can take to move the campaign forward. So before I introduce our first presenter, I want to say a few words about why we're here. The gross inequalities that characterize the global rollout of the first generation of COVID vaccines are being replicated again today when it comes to distribution of promising new COVID outpatient treatments and diagnostic tools. As a result, the test and treat strategies that are being used in the United States to prevent the worst COVID outcomes simply aren't available in low and middle income countries, leaving billions of people around the globe without access to not only the most effective vaccines, which leaves them at higher risk in the first place, but also to simple tests and effective therapeutics. This inequality continues to cause huge numbers of avoidable hospitalizations and deaths every day, as well as greater and greater incidences of long COVID, and compounding the economic, societal, and political harm of a prolonged pandemic. There is a reason for all of this needless suffering. Just as with the mRNA vaccines, the COVID treatment supply is being kept artificially low, and prices are being kept artificially high by pharmaceutical monopoly rules that put so-called intellectual property rights ahead of public health. According to the ACT Accelerator Global Health Consortium that was set up in response to COVID-19, no significant doses of any outpatient COVID antivirals have been purchased by low and middle income countries. Said more plainly, if you're not living in a wealthy country, you don't have access to COVID medicines. This is in part because high-income countries led by the United States have together bought up 30 million courses of treatment at inflated prices for the most promising COVID treatment regimen called Paxlovid. This number represents the entire first 6 months of Pfizer's supply of the drug, meaning it has almost none immediately available for sale for the rest of the world. The US has also purchased the lion's share of less promising treatments like molnupiravir, remdesivir, and monoclonal antibodies. Beyond the normal wealthy nation hoarding, the price quoted by Pfizer to middle-income countries whenever more doses eventually become available is $250 per treatment. That's literally 10 times the $25 per course price that generic medicine makers have indicated they can manufacture and sell Paxlovid for in the limited number of countries where generic competition has been allowed by Pfizer. So, put simply, we don't have enough pills to go around, and the price of those pills is way too high. The solution to this is simple. Allow generic COVID tests and treatments to be produced in as many places as possible, as quickly as possible, to increase the supply and lower the prices. As we're going to hear in a minute, efforts are underway in countries like Colombia, Chile, Peru, the Dominican Republic, and elsewhere to issue compulsory licenses that would allow Paxlovid's component drugs to be produced without waiting around for Pfizer's approval. Our job as activists is getting the Biden administration to support these and related efforts at test and treatment access. Just to be clear, the quickest and easiest action the Biden administration could take is to publicly state that it supports efforts by other governments to issue compulsory license for COVID vaccines, tests, and treatments, and that it won't challenge their right to do so, whether that's at the World Trade Organization, through US free trade agreements, or any other mechanism they have available to them. Historically, the US government has sided with Big Pharma strongly in discouraging countries from using compulsory licenses. Even though we ourselves have already issued 59 compulsory licenses for US production during the COVID crisis, and other well-off countries like Israel and Russia have also done so, many low middle income countries remain really paranoid about the US government bringing down some heat on them for doing that. For instance, public health advocates working on compulsory licenses for Paxlovid in the Dominican Republic say they believe the Dominican government opposed issuing a license there out of fear that the US would be angry with them about it. So an executive order, or even just a press statement indicating that President Biden sides with countries that prioritize access to COVID medicines would go a long way to easing government's anxieties about provoking U.S. hostility from compulsory licenses. As I think a lot of you know, after more than 2 years of debate, the World Trade Organization issued a face-saving text in June that allegedly addressed access to COVID vaccines. Unfortunately, that text left too many intellectual property barriers in place to expand vaccine access. But public health experts the world over agree that even the existing test would actually be helpful if expanded to include treatments and diagnostics, which are far easier to produce than vaccines and don't require much, if any, technology transfer. So in recent weeks, South Africa, India, Egypt, Indonesia, Pakistan, and other countries have all called on the WTO to do exactly that, with India specifically calling for a decision to be made by the WTO's General Council meeting in October, and others saying they want a decision by the end of the year. So whether it's in October or December, pretty much everyone agrees that the United States' ultimate decision on the matter will be the single deciding factor on whether the proposal moves forward. The last time around at the WTO, the Europeans were the bad guys blocking access to COVID vaccines. When it comes to tests and treatments, the Biden administration is going to be the decider, not Europe. So for those of you following this issue closely, you may have seen some pretty pharma-skewed reporting after the last WTO General Council meeting, reporting that tried to paint the picture that the Biden administration has already decided against tests and treatments being added at the WTO. It's obvious why that kind of storyline is in pharma's interests, but thankfully that line simply isn't true, at least not at this point. It's super frustrating that the Biden administration isn't out there actively supporting test and treatment access, but they're not actively opposing it. The U.S. trade rep herself has said that the administration is open to the idea and is considering it. And it's actually our belief that the U.S. government may be trying to figure out what they can get from global South countries in exchange for supporting some test and treatments deal, which is kind of gross, but it's a far step better than them being against it altogether. So the bottom line is, the world is counting on us to get the Biden administration to do the right thing here. Expanding access to tests and treatments is key to saving lives abroad and would help tremendously in slowing the pace of new variants that continue to flare up around the world. So that's why we're here today. And with that, I want to introduce our first speaker, Maza Seyum of People's Vaccine Alliance. Thank you so much for joining us, Maza. Go ahead.
Thank you so much, Hillary, and hi, everyone. And Hillary has actually done most of my work for me today, so I think my intervention is going to be quite brief, and I'll be handing over to our colleague from MSF in Brazil, who's going to be giving much more interesting detail about what's going on the ground. But as Hillary said, I'm here with the People's Vaccine Alliance. I'm the Global South convener. For those of you who do not know the People's Vaccine Alliance, we are a global movement, a global campaign of close to 100 organizations, world leaders, faith leaders, economists, activists like yourselves from around the world fighting and campaigning for COVID-19 tools available free of charge to everybody who needs them around the world. The work that I do as Global South convener is really working to amplify the efforts of our colleagues from around the world. We have members in Africa, in Asia, in Latin America, and the Caribbean to make sure that their strategies and needs are really the ones that are at the forefront of the work that we do. Trade Justice Education Fund is a member of the People's Vaccine Alliance, and MSF is a great friend of the People's Vaccine Alliance, which Felipe represents here. Just in terms of the background, which I think is important and relevant, the People's Vaccine Alliance was first launched in May 2020 by people who had worked on HIV. And I think that is relevant because that effort started with an open letter before vaccines for COVID-19 or treatments for COVID-19 were even available. People who had worked on HIV got together and said, let's not let the same inequity that we saw with HIV rear its head with COVID-19. Those of us who remember those days remember fighting for treatment when there were some people in the global north, in the United States and in Europe who were living, basically normal lives with HIV. There were relatives of ours in Africa and across the rest of the world who were basically living with a death sentence hanging over their head and dying of HIV and AIDS when treatment was available elsewhere. So that was a call that was put forth in May 2020. Let's not let the same thing that happened then happen again. But unfortunately, as the head of the UN said, I think around this time last year, we, with the science and the way how quickly vaccines were developed, we got an A in science, but really an F in ethics. The way the vaccines were rolled out were really shameful. We had countries that are at 60% fully vaccinated, where in some countries in Africa, we were still at 2% fully vaccinated. In terms of what, Hillary has spoken about, what happened in July in Geneva at the World Trade Organization in June, that was really a crushing blow for many of us. But I want to highlight sort of the things that were silver linings and the reasons for hope, just to keep us all motivated in this fight as we go forward. One, we were part of a global movement that really forced rich nations and pharmaceutical companies to finally accept that IP rights and monopolies from Big Pharma were a block. Yeah, for many months, they refused to admit that, and finally they did. Secondly, the fight for the TRIPS waiver really made it undeniable that trade and health are linked. Yeah, for some people, that's sort of like a cloudy, not quite clear, but now I think it's been made obvious that trade and health are really linked. Thirdly, those of us who've worked on reproductive health and on HIV, as I've said, and even non-communicable diseases, we've known that the global health system is really unjust and racist. And now I think for many people who maybe didn't have that front of mind, it is now obvious. We can't deny that the global health system really decides who lives and who dies based on where you're born, your ethnicity, color of skin, et cetera. So that has been really made quite obvious. And finally, I want to say that the global outrage that we were able to generate was really quite moving to a lot of people. I worked with Hillary and colleagues at the Trade Justice Education Fund earlier this year when we were commemorating the second anniversary, I say in quotes, of the pandemic. And, we had colleagues in Malawi, in Kinshasa, in, Phnom Penh, who were really moved to see activists in the United States, a country that for some people is seen as being quite inward looking, to see activists in Dallas and Seattle coming out to really speak forcefully about the need for global vaccine equity. And that was very moving to them. So I want to just encourage us to keep going and keep that, sort of energy in this fight for treatment and tests. As Hillary has already said, the same exact inequity we saw with the vaccines is rearing its head again with treatments. Hillary has already given us some of the background figures. It's actually quite hard to get clear data at the moment. I struggle to find clear data. I was hoping to show a slide today. But what I can say is that in countries, in low-income countries, only 20% of people are vaccinated. So you can see the importance of having access to treatment in that sort of situation, because you're not vaccinated, you're much more likely to die of COVID. That's why it's even more urgent that you have access to the Paxlovid or to another treatment that is available in other countries, but not available to you. One of our partners has done a 14-country survey on access to COVID-19 tools and found that in many countries, even healthcare workers have never had access to Paxlovid. Some of them in Haiti and in Nigeria had never even heard of it because the access to it is so limited. We heard one story from a Minister of Health representative in Somalia who tried to order for citizens of Somalia, a country of 15 million people, tried to order 3,000 courses of Paxlovid, had money to pay for them despite the high cost, because as Hillary said, with them being not generic, they're 10 to 20 times more expensive than they should be, tried to order 3,000 doses and was delivered just 300. And when asked why, was told that's all we had set aside. So again, the same situation where you have people sitting, in Geneva or in Washington, D.C., deciding who lives and who dies, the same way it happened with vaccines we're seeing now with treatments. The same situation with testing. And obviously, we've heard so many stories about how, the toll of COVID was not as high in Africa because the numbers didn't show that high level of COVID infections. That has actually been shown to be not true. The reason why people think COVID did not hit some countries that hard is because testing was not available. 2.5 years into the pandemic, I can tell you that I have aunts and cousins in Ethiopia who have never had one of those little Q-tips up their nose to be able to get a rapid test for COVID. There are many countries where people just do not have access to those. So, and especially in countries where people are really susceptible to other illnesses that have similar symptoms, like tuberculosis with the cough, malaria with the fever. It's that much more important for people to be able to have access to those rapid tests and, as I said, to the treatments. Now, in terms of what we're here for today and the way forward, really pushing the US government to do what it needs to do. As Hillary said, we keep hearing stories that the US, the UK and Switzerland are explicitly against expanding the TRIPS waiver to tests and treatments, but the US says, that they would in theory be fine with it, but that they're kind of observing markets to see what the market situation will be in a few months, continuing to see this valuing of markets and of profits over lives. So, that's why we're here today, to really kind of push, to figure out what we can do to push the US government to do more, to do better. It is unacceptable for people sitting in air-conditioned rooms in Geneva and Washington, D.C. to continue deciding who lives and who dies and whose lives are worth more than others. So with that, Hillary, I will hand back over to you, and I'm available to answer questions after Felipe. Thank you.
Awesome. Thank you so much, Maza. Super grateful to have you here and look forward to the Q&A at the end. Want to remind folks that you can submit questions to the Q&A function at the bottom of your screen. And with that, I'd like to welcome Felipe de Carvalho from MSF Rio. Go ahead, Felipe.
Thank you. Thank you so much, Hillary. Thank you, everybody, for joining us today. Thank you, Maza, for your great overview of the terrible situation we are still seeing around the world. I will focus today on Latin America. Currently the MSF Access Campaign Regional Coordinator in Latin America. So I have been working on since actually 2011 and in many topics, HIV, tuberculosis, hepatitis C. But of course, in the past years, we have focused quite a lot as an organization on responding to COVID, and also to make sure that people have equity on access to vaccines, and that there is a possibility of universal access to vaccines, treatments, and diagnostics. So to start, I don't know if I can pass my slides, sorry. Why I cannot pass? Yeah, here, can you see my second slide? Challenges in Latin America?
Yes.
Yeah? Okay, perfect. So before starting, I think it's important to give an overview of the region in terms of challenges that we saw before and during the COVID-19 crisis. First, it's the disproportionate mortality we have in the continent. We had countries leading the ranking of daily deaths, like Brazil for several months, Peru after that. And despite the fact that Latin America has only 8.4% of the world's population, the region concentrated 1.6 million deaths, 28% of the total until the end of 2021. There is a growing inequality in the continent for many reasons, but also accelerated by the COVID crisis. So 17 million in Latin America have moved into poverty in 2020, and we are in the worst economic recession in 120 years. We also saw in the region the governments facing very hard conditions to have agreements with pharmaceutical companies to buy initially vaccines. So there were 13 countries that had to change their laws only to be able to accept the terms and conditions that pharmaceutical companies were requiring from governments. And this is a sign, an example of how against the wall these countries were in terms of trying to secure some doses to their populations. There is still a huge exclusion from access to treatments. And when we look to licenses and to prices, we see that the region is really excluded and in a very difficult situation to negotiate and to have access to generic versions of the treatments that are already available in some places. So for example, in the case of Paxlovid, the drug produced by Pfizer, only 8 countries in the region are actually able to benefit from the license and have access to generics. The others are in the opposite situation, which is a very hard negotiation position and the need to accept any condition imposed by Pfizer. That's why we are very concerned about this kind of license, because those countries excluded, they are actually in a very worse position than if there was no license at all. And also there is other drugs that we are also concerned about, For example, baricitinib, which is for severe cases, it's still a challenge because of patents and high prices that we see across the region. Also, we had a moment during COVID, and actually even before, where there was no really a strong political coordination between countries. So for example, on the waiver negotiation, Latin American countries were not coordinated, and only 3 countries in the region actually supported the original proposal by India and South Africa. And also some initiatives that we normally see and that used to be very successful in Latin America, like joint negotiation, pool procurement strategies, they are now under risk because the tax that was approved at WTO actually undermines this kind of strategy. And I will go in a little bit more detail about why. But just to give you also some numbers and some maps, some graphics about the situation on treatments. If we look baricitinib, this drug that I mentioned that is for severe cases, if we see, for example, the situation of Argentina paying higher prices than Denmark, than the United Kingdom, than France. In the case of the Paxlovid license by Pfizer, you see in the map, most of the countries in the region are in red, so they are excluded. They cannot buy any generics, and they cannot even have access to active ingredients to develop their own generics. So it's, as I said, the situation in which we are really in the hands of Pfizer, and we need to accept their price conditions, their delivery conditions, everything they impose to our countries. Just to quickly comment about the waiver, Maza already mentioned this negotiation and why we don't like the outcome. But from MSF point of view, I think the problematic aspects are especially that this decision has not actually created anything new for countries to use during a pandemic. We were expecting a new pathway, a new solution, a new option, but actually we only saw a kind of amendment or a new exception in something that was already there, and that is very specific. So that was one of the bad points. Also, there is a kind of eligibility criteria that divides countries, and some of the countries can use the decision, but others are not encouraged to use the decision. So this is also very problematic. As I said, we also have in this final text what they call anti-diversion, which is something that companies, pharmaceutical companies, they love to push for that because they don't want their drugs to be sold to one country and then shared with other countries. So they create a lot of controls around that. But actually, during a pandemic, that's exactly what we need. Countries sharing with each other, doing joint strategies, collaborating, and the decision has language that undermines that. The decision-making process, we would need another debate to only discuss that, but there were many issues on transparency, on what countries were on the table to reach a final decision. There was no democratic process at WTO at all. And also we are now at the point where we do want to see, something that can help us on access to treatments and diagnostics, but the text that was approved for vaccines, it cannot be copied and pasted for these other health tools. It doesn't make sense for treatments that we have the same limitations, like anti-diversion rules, the controls about which countries can benefit or which countries should not use the decision. This kind of language should be changed if we are really to move in the direction of expanding this decision to other health tools. But for the time being, what we are trying to focus right now, it's like what governments can do beyond relying on WTO, because we know WTO has many problems of governance, of corporate capture, a lot of problems that are driving the decisions away from what is needed from a public health standpoint. So what governments can do on their own, actually suspend intellectual property is something governments can do using this waiver decision, but also using other means, other articles of the WTO TRIPS agreement, like the 73, which is for national security reasons. There are some activists and civil society groups in Ukraine, for example, tried to use that to suspend intellectual property in Ukraine for the time being. Governments can also issue compulsory license on the way they already have in their laws, but also countries are strongly encouraged to adopt new laws and policies or reform the laws they have to make best use of compulsory licenses. And in some countries in Latin America, this has actually happened. In the picture, you see part of the campaign that we had in Brazil to change the law so we can have better compulsory license provisions. And actually, this is something we can all discuss together, but the point is like, what is exactly the compulsory license we need? And for those of you that are not familiar with the term, compulsory license is basically when the government can terminate a monopoly situation to address a public health need. So when a compulsory license is used, basically the government allows third parties to produce a particular drug or a vaccine. And there are some, arrangements, for example, royalties that are paid to the patent owner, and there is a time limitation. But during a moment, there is this situation in which other suppliers can come in and drive the prices down and make sure that there is enough quantities for everybody. So it's a public health flexibility, as we call, and we strongly encourage that governments use that. But over time, it has proven to be very challenged to use a compulsory license. So we understand now that it needs to become, in many countries, less bureaucratic, less dependent on political will, more effective and fast, more democratic and transparent. And there are three words that are more like looking towards the future. We think compulsory license should be normalized as something that needs to be done constantly for a variety of drugs, for a variety of health technologies. It needs to become more automatic. For example, a public health emergency can automatically trigger a compulsory license process. So it doesn't depend on the president, on ministries sitting in a long process, having 2 years of discussion between different stakeholders to decide. So it should be faster and automatic. It's something that we can defend and discuss how it can be done, so it can be done more in the time of a public health emergency. It can be really responding to the needs, and holistic in the sense that normally compulsory license are only used today to overcome patent barriers, but we realized during COVID more than ever that there are other intellectual property barriers like trade secrets, copyrights. So compulsory license need to be also expanded so we can also unlock all these barriers, remove all these barriers at the same time. And I'm just mentioning that because in Brazil, some of the reforms we are fighting for and that are actually coming true have to do about more democracy around the compulsory license process, so civil society can have a voice and participate. There are more deadlines to the government so they can not delay and keep it on hold forever. So there are many improvements that are important so countries can make best use of this public health flexibility. As I'll try to just give a few examples now, there were many cases in Latin America where actually there were initiation of compulsory license campaigns. There was attempts by governments in the region to use this approach, but actually there was a pushback from the US and from pharmaceutical companies. So this was actually the reason why these compulsory licenses were never finalized. And normally there is the special 301 report by the US Trade Representative Office that actually blames governments for using compulsory license and put them in a list that is said to harm their, they will not attract investments if they are in this list. So governments are really afraid of this pressure that comes from the US government. But interestingly, in 2021, the special 301 report was totally different, and there was some interesting sentences that I think we should use that in our campaigns. For example, the United States emphasizing that the countries should promote access to medicines for all, and that the United States respects the right to grant compulsory licenses. This was very unique. We never saw that before in the Special 301 report. We saw the opposite, the US government blaming governments for doing that. So yeah, this should be the standard. This should be, the floor, and we should improve on that, because still they say like, yeah, governments can use during a very critical situation. And we think maybe it's not necessarily during a pandemic, but can be in a situation where there is a high price or another challenge that countries are facing. So yeah, but it's a good starting point, and I think we should, use that in our campaigns. I don't know. I think I'm a bit in the end of my time, but if I can just mention a few examples. When I say pharma threats and US government pressure, I just would like to be a little bit more specific, because right now we have some countries in the region trying to promote access to Paxlovid and other COVID treatments using compulsory license as a strategy. But there were past experiences where things were not good at all. For example, in Colombia, in 2014, there was a strong campaign by civil society to have a compulsory license over a cancer drug. And actually, we saw a lot of pushback by Novartis, the company that was responsible for this drug. For example, they sent a letter to the Ministry of Health saying that actually their decision would harm relationships with other areas like trade, industry, and tourism. And just a few days later, there was a complaint by Novartis against the Colombian government using this kind of investor state dispute mechanisms that they had, and threatening Colombia to pay, damage to the company. There was also a letter to the president of Colombia saying that they do not agree with the decision that the government was taking to declare this particular drug of public interest and to initiate a compulsory license procedure. So we clearly see that, there is very strong and intense and continuous pressure when a government tries to start to use this kind of this mechanism that they have actually the right to use. But when they try, there is this kind of pushback, letters, bilateral pressure, threats, all that. And at the same time, the US government was also threatening to interrupt the funding that they were providing for the peace agreement that Colombia had reached due to their civil conflict. And there was a plan, and there were a lot of funds needed to implement the peace agreement. And the US government was supporting that, but at some point there was a leak showing that the US embassy in Colombia was actually informing the government that if they were to move ahead with the compulsory license of this cancer drug, the US could potentially withdraw their support to the Colombian government on the peace process, which was a very strong and high level pressure case to demonstrate how these things are in practice. And very quickly on Peru, there were a similar story where actually civil society was also trying to have a compulsory license for a HIV/AIDS drug. And then the company was at first attacking the civil society organizations, threatening them with litigation and sending letters. And this actually all started because there was a group of civil society organizations that have done a kind of a media thing, a press conference, where they were criticizing the prices that Bristol was charging for this HIV drug in Peru. And then the company came back to the civil society coalition and said, you are, attacking my reputation. You should apologize for what you said in this press conference. Otherwise, I will take legal actions against you. So it comes sometimes to this level of threats to civil society groups that are trying to improve access to treatment. And also during this whole process in Peru, there were many episodes, but there was also clear involvement of the US embassy in Peru, trying to convince the Peruvian government to step back on this idea of doing the compulsory license for this HIV/AIDS drug. And in the end, that was what happened. The government never used this. After some meetings that the US Embassy had with the president of Peru, the country started to declare that they would give up on the idea of the compulsory license. And at first they were quite motivated, they were taking steps. So we see that this is very real and effective pressure. And just a final example, in Brazil, as I said, we have been going through a campaign to reform the Brazilian patent law to improve the compulsory license. And it's very common to also see this kind of threat by the head of a lobby group that represents multinational pharmaceutical companies. And she was basically saying, yeah, if Brazil moves ahead in changing the law and having better provisions for a compulsory license, companies may decide not to supply Brazil during the COVID crisis. And she was saying, this is not retaliation, it's just that maybe companies prefer to sell in countries that respect their patents and all that. So yeah, this is also something we see quite often, the threat of not supplying the country that is trying to do something to ensure access to their population. I think that's almost my last one, just so you have an overview. Now looking at COVID and what we have now in the region in terms of campaigns, we have in Brazil, as I said, we had actually a law reform already approved, and now it's a matter of implementation. So we are discussing with specialists and we are doing national campaign to make sure we have the best implementation of the new law that has some very positive aspects, thinking about public health and access. In Chile, there is also a law reform to improve their compulsory license provisions. In Peru and Colombia, they are focusing on Paxlovid, and they are trying to use something that we call public use. It's a kind of compulsory license, but a little bit more limited, because it's only to allow the government negotiations and the government purchase actually to benefit from the compulsory license. So it's a more strict compulsory license, and only to benefit the public services, the public health facilities. So they have never tried this particular mechanism. So they are doing campaigns in both countries right now. So their governments can use this particular, they can try to use this particular mechanism. In Dominican Republic, we have a compulsory license case that was filed by civil society. I believe many of you are aware, but there is also now a dispute with Pfizer that have thousands of lawyers working on the case and responding to the demand. And the government of Dominican Republic has not yet given any signs that will really respond positively to the compulsory license request that was made. But these are the cases that we need support, attention, visibility. And as Maza and Hillary said, any high-level declaration by the Biden administration that they support compulsory license, that they are not against, that they will not do anything to countries that go through this route, it's really, really helpful. And last thing, I was recently in a civil society event in Istanbul, and we also had some discussions there about how to take forward the efforts we have developed during the COVID crisis, the coalitions that were created. And something we still consider very important is the work with the media, the press, the journalists. So the final declaration of this event in Istanbul came up with some very specific requests and suggestions to journalists. And I think that's something we can all have in mind and keep trying to address. For example, more stories on experiences because lack of access to treatment and prevention, more investigations to uncover pharmaceutical industry tax avoidance practices, more stories on this lobbying against countries that are trying to improve their laws. This all can help us because in many of those cases, we saw that exposing companies, exposing what the US government was doing was really helpful. So we need to keep this in the agenda of media and journalist networks as we move forward. So I think that's all. Sorry for taking so much time.
Thank you so much, Felipe. I think that information was super helpful for me, and I like live in this world, so I'm like really, we're just really grateful to you for bringing up all those examples. I do want to flag for folks that just like Felipe was getting to at the end, that one of our campaign goals, one of our top goals, is to get the Biden administration to do some kind of signaling publicly that they won't go after countries that are trying to issue compulsory licenses for these treatments. Awesome. So we have tons of questions in the Q&A. So super grateful to all those folks submitting questions. Don't hesitate to keep putting those questions in the Q&A. We will get to all the questions that say, what can I do about this locally, in just a little bit. But one of the questions, and I have a response to this, but I'm going to kick it to Maza and Felipe first. How can the Biden administration focus on test and treat as a strategy for dealing with COVID in the United States and not forcefully back access to tests and treatments around the world? Won't that just lead to new variants and more deaths? Maza or Felipe, do either of you want to jump in on that one?
I'm sorry, Hillary, I missed part of that. My line cut out for a second.
Totally. I'll repeat the question really quickly. How can the Biden administration focus on test and treat as the strategy for dealing with COVID in the United States, but not forcefully back access to tests and treatments around the world? Won't that just lead to new variants and more deaths?
Yeah, I mean, I can get started on that. And I was thinking that actually, as Felipe was talking about how short-sighted all of this is, it's not only immoral, but it's also on a public health perspective, it's just dumb because, people want to think or hope that COVID is over. And, I hear people in the United States or elsewhere saying, I'm done with COVID, and COVID is not necessarily done with us. Yeah. I mean, we saw this with the variants that, that came last year and earlier this year. So yes, I mean, I agree fully with this questioner that it doesn't make any sense. And we've seen that the nationalism with the vaccine rollout did not, people think that they're protected when they're just protecting their countries, but it showed that that absolutely was not the case, because then we ended up with a more infectious variant and more deaths. And, I just wanted, and I mentioned this briefly in terms of the number of deaths, but I don't know if I said it clearly, the estimates that I still see of numbers of deaths is about 6.5, close to 7 million. But what we're seeing with the modeling figures, it's probably much more than that. 15 to 20 million people have died from this virus, over the last 2.5 years. So just to completely agree with the questioner, it's short-sighted, it's immoral, but it's also just on a public health level, completely ridiculous. And, it will probably continue to backfire. So that would be my comment to that.
Yeah, and I think also just to add quickly, I think one of the most important requests to the US as a major funder of innovation on health is to make sure that the knowledge is shared and to have arrangements where this can happen. Because of course, that the US can have a very strong test and treat strategy. And if there are a few companies controlling the production of a given drug or of a given test, what we need to do is to share knowledge so others can also produce and also actually adapt. When we talk about local production, it's not only about, diversifying, but also sometimes, by doing that, you can enable countries to adapt a given treatment to their reality or do a combination treatment that is even better. So unlocking the knowledge is very important. And when we talk about the US, we would assume the US has a strong leverage as a strong financer, a strong funder of health innovation through the NIH, through different universities. And what is missing is something that can connect the public funding with conditions. So companies cannot do whatever they want when they have control over the drug. They need to follow some, principles or some, commitments. Like sharing know-how can be a very important one when we are talking about having access to treatment for everybody. Because of course, when you have few companies, then you have scarcity, and then if the US buys everything, other countries will suffer with not being able to buy anything. So yeah, it's possible if we share knowledge. Knowledge is not scarce, and if we share it, we can have a different situation.
Awesome. Thank you for that. I'll just say quickly that there was a lot of chatter in the test and treatments organizing space when President Biden came down with COVID and was taking Paxlovid, and all of us kind of looked at the situation and went, wait a second, like you're now taking it to get over COVID for yourself. Like we definitely need to get access for folks in other countries. Awesome. So I think that this question is probably for you, Felipe. The person says, hi, I really enjoyed your presentation. I was wondering whether access to these medicines was purely monetary or if there were other like conditions required for access. I think in regard to the compulsory licensing or other things that Pfizer was asking countries for just to get access to some of the drugs that Pfizer was offering.
Sorry, Hillary, the first part, I think I didn't understand actually.
Okay, I was wondering whether access to these medicines was purely monetary or if there were other conditions, just talking about what kinds of things that Pfizer might ask for when it decides to give a country access to Paxlovid or access to vaccines, that kind of thing.
Well, yeah, that's a difficult question, but of course they look to the more interesting markets first of all. So of course, high income markets are their first top priority. So if they don't have enough quantities for other countries, they will prioritize those that can pay higher prices. And also they will try to put middle-income countries, like most of Latin American countries, in a situation where they need to pay the maximum they can. Of course, with Paxlovid, there is guidance that needs to be followed as well. There are priority groups that should take it according to WHO guidance. But more and more, we are talking about, how beneficial would be to have broad access. So actually, the demand can be very huge in the whole of the countries. Now in Brazil, for example, it's still limited to some populations. So it's not really a test and treat strategy. And the price is very high. So the government is doing it by phases and purchasing little by little. But when it comes to vaccines, maybe also the question also refers to that. I mentioned that there were 13 countries in the region that had to change their laws to accept the conditions that companies were asking. And Pfizer was one of the countries selling vaccines. And actually, they were also pushing countries to take responsibility over any damage or liability over the use of vaccines. And actually, for some countries, they have asked public buildings and even military buildings as collateral for any problem that, any damage that Pfizer would face. The countries would have to commit with their public assets and sometimes going beyond like just money, but also, other things. So that was really something that countries had to change their laws to accept this kind of conditions that companies were imposing. And some of them refused to negotiate under those terms.
Awesome. Thank you for that answer. I think with like 10 minutes left in the hour, I want to pass it to Ime for some action items to help us move the campaign forward. Ime, go ahead.
Hi, everyone. I'm Ime. I am the Oregon organizer with Trade Justice Education Fund. Like Hillary said, I'm going to share a few things about what you can do to support the movement for tests and treatments around the world. Before I do that, though, I really want to take a moment to thank you all for being here, for continuing to be active witnesses to one of the biggest moral failings of our time. I think, I speak for everyone here in this room when I say that I'm really pissed. It should not be controversial to say that healthcare is a human right. It should not be radical to declare that everyone deserves a chance at life, deserves a chance at treatment. And like Maza and Felipe said, this is not the first time that something like this has happened. But we can make sure that this is the last time, right? Like right now, we have the potential to set the groundwork to change the course for future battles for healthcare sovereignty and for global human rights, right? Like we have multiple active global crises happening right now, right? Like we need to set the groundwork that in the future things will look different. And I'll get off my soapbox in a second here, but you know, there are people who will say that this is a complicated political issue or economic issue or whatever else, and I don't want to minimize that. But we all here know what this is really about. We know why we're here, right? This is about the inherent dignity and value of human lives. And people over profit is not just a catchy slogan, right? It's our moral imperative. And we've heard that over and over again in this webinar, so I won't, you know, kind of beat it over your head. But yeah, so here we go, right? We've heard our speakers say today, Biden signaling support for a decision on tests and treatments would go a long way in moving the process as a whole forward. So Noelle here is going to drop a link in the chat where you can send a letter to President Biden demanding that he support the use of compulsory licensing, a WTO IP waiver, and whatever other tools he has to expand access to COVID tests and treatments, and demanding that when countries try to use compulsory licenses, that our administration, our presidential administration, will not stop them. And we need as many folks as possible to send letters to the president, letting him know that we're watching his decision at the WTO, and we're watching the compulsory licensing battles happening in Latin American countries, right? We are still here 2.5 years later, and we still believe that no one is disposable, and we are not going to let them get away with this again, right? So please send in your letter and share the link on social media, Twitter, Facebook, wherever, email your friends. And secondly, the first week of October will be an incredibly important moment for this campaign. Student groups and many others across the country have committed to taking action ahead of the WTO General Council meeting on October 6th and 7th. Put that in your calendar, save the date. India has called for a decision to expand access to tests and treatments for COVID-19 at that General Council meeting. So that week, students across the country will be doing educational events and having rallies on their campuses ahead of that meeting. This week of action in October will be incredibly important to show the administration that they can't get away with stalling and not supporting a deal on tests and treatments at the WTO. So in a second here, I'm going to put up a little Zoom poll asking for folks to commit to taking action on the petition or the October week of action and some other things. So please mark the actions that you feel comfortable taking. That way we know to follow up with next steps. Boom. The poll should be up. Thank you. Folks are already responding. Let's all take a second to commit to some action steps. Thank you so much. I see folks are committing to send the letter. And also really exciting, folks committing to helping to coordinate an action during the October week of action. Thank you to folks committing to sharing the Action Network link with their friends, coworkers, any Slacks that they're in. I know that there are a lot of, for example, like Medicare for All Slacks or other healthcare advocacy Slacks that you can share all this info in. Really appreciate that. I see a student saying that they'd love to help with student organizing on their campus. That's super exciting. This is our future, right? And I think students really know that, as students have had their entire youths upended by this crisis.
Amy, I want to interrupt really quickly to say I see folks in the chat saying it's only letting them choose one. I'm so sorry, we must have set it up incorrectly. But if you mark any of them, someone from our team will follow up with you on action steps. I'm so sorry for folks. Please. Oh, now I see from someone else that they did get to choose multiple ones. So I'm not sure what's going on, but if you mark any of those, someone from our team will follow up with you. Sorry to interrupt you, May.
That's okay. Yeah. And if you're not sure, just pick one so we know to follow up if you're just interested in hearing more, right? And cool. I think we can take another minute or so, Hillary. I see most people have responded.
Awesome. So I am gonna go ahead and end the poll for folks who haven't answered. It's gonna disappear. But someone from our team, Trade Justice has organizers in Washington, Oregon, California, Texas, New York, and a couple of folks that we partner with in Maine. And if you're not in one of those states, I will probably be the one reaching out to you, or Noel, but we will make sure that you get plugged in and get connected to the right person and get plugged into all of the stuff going on with the petition and the week of action. Thank you so much, Ime, for presenting those action items. Thank you all for being here. And I want to thank especially Maza and Felipe for taking time out of both of their busy schedules to join us for this afternoon and share some of the urgency around things that are going on. Awesome. Thank you everyone so much. We'll be in touch really soon on those action items. Have a great afternoon, everyone.
Thank you so much.
Thank you. Bye-bye.
Bye-bye.